All right, so everybody, welcome back to another episode of Beyond the Product podcast, where we spotlight innovative leaders transforming healthcare today. I'm very excited to welcome Megan Walker. She's the founder and CEO of WeeCare Pediatric Home Healthcare. Megan's not just a visionary entrepreneur, she's a decorative pediatric nurse who's breaking the barriers and creating new standards in home healthcare for children. Welcome, Megan.
Thank you.
All right, so we'll start with the personal journey. We'll start going through a couple things like that, and we'll have a fun time doing it, okay?
Sounds good.
All right. So your passion for helping children with special needs started very early. From volunteering, I saw, to the coaching in the Skate Canada's Can Skate program. What inspired you to dedicate your life to pediatric care?
So everybody always asks me that because they say, you're just so drawn to it. Like what did it? Did you have a personal experience? And I actually didn't. I lived down the road growing up from a pediatric hospice. And so it was always talked about in my home that, oh, that's a place where, kids who are medically complex go and things like that. So it was always aware. I was aware of it. And then I just kind of started noticing that everything I did in my life was kind of veering towards special needs kids. And I just had that draw towards them. I remember my grandma saying to me once that, you're the only one who will look at someone who has like a trach in their throat and think, oh my gosh, what a cute little child. She's like, you don't feel pity for them. You don't feel sad for them. You just are naturally drawn to them and see them differently. And I think just throughout my time volunteering and doing those experiences, it was very clear to me that I did have a special place in my heart for special needs kids.
That's amazing. You speak my language with all of that. It takes an exceptional person to do the things that you've done in your career, in your life, and experiences at the hospital, have made me that way as well. It's very, I know you're hitting at home when you're speaking to me. All right.
Yeah. Yeah.
All right. So, as the first RPN to receive both the Nurse Innovator Award and the Entrepreneur of the Year Award, what challenges did you face, like transitioning from nurse to CEO?
Oh, so what challenges did I face by receiving those awards or just
Well,
trans?
I was just targeting, like, acknowledging the awards, but when
Yeah.
you transition from nurse to CEO, I'm sure.
So yeah. So I think the biggest challenge was obviously, when you go to nursing school, it's focused on nursing. And I don't know if you know this, but there's no business course in nursing school. Um so I went from, being hands-on, a bedside nurse, community nurse, doing all that to all of a sudden it's, oh, wow, I am now running a company. Oh, I have employees. Oh, I need to, set up payroll. Like, how do I know how to do all of that? So it was definitely a big adjustment. I loved it. Like, I loved the journey. But I think it's just understanding what needs to be done in your role. Like, I really understood what was needed and what those next steps were. And even if I didn't know how to do it, I would reach out and get the support and learn. And even now, I still work with clients and I still go out into the community because I love it. At the end of the day, I went to school to be a nurse because I absolutely love nursing. Even though I now am in a CEO role, I still deep down am a nurse. So just adjusting and understanding what needed to be done. And if I didn't know it, seeking out those answers and support to help me along that journey.
That's great. That's great. Reaching out, doing, because yeah, when you go to nursing school, there's no business involved, right?
No.
That's absolutely correct.
Yeah.
So WeeCare isn't just about medical care, right? You focus on the emotional, social, and developmental support. How does the holistic approach benefit families?
So with us, we notice that the families, it affects their mental health in a positive way. So by us, focusing on the holistic approach as well, and not just the client's needs, but the family's needs as well, and what works best for them in terms of the care for their child, that allows them to have peace of mind and they trust the care that's being provided to their child, which in turn allows them to not feel stressed out. They're not going to worry. They're able to go to sleep at night knowing that the nurse who's, watching their child while they sleep is someone that they can trust and know will take care of their child. So now they're able to get a good night's sleep, which affects, mental and physical health as well. So it really has a big impact on, we notice the families when we do a holistic approach like that.
That's great. And just to piggyback a little bit, like right off of that question, so every child is different, right? And every child does have unique needs. Can you walk us through like how you develop like a personalized care plan for each child?
Yeah, so that's one of the biggest things is all of our care plans are individualized to each child and family's needs, like you said. So how it works is what we do is our director of care will sit down with the family and go through all of the care needs, even if there's any physio exercises that are needed to be incorporated, we make sure those are included as well. And we have a very detailed care plan that even talks about the child's likes and dislikes, talks about sibling involvement. And then even when it comes to scheduling, our scheduler will sit down with the family as well to make sure that the schedule meets the needs of the family as well. Because if someone's needing, after school care for their child, it wouldn't be beneficial to schedule someone in the morning. That's not meeting the needs of the family. So it's not just about throwing the support in there just to, throw it in. It needs to line up with the family's needs as well. So we sit down and have lots of communication with the families and even other healthcare providers on the team to make sure that everything is aligned with the family and the child.
So great. So it's all awesome stuff. All right. So now like we'll roll into a little bit of like innovation in pediatric care, right? So I did my research, check the website out. So as you know, you're known for bringing innovation to the pediatric healthcare, right? What changes have you implemented that are making the biggest impact?
Ooh, that's a good question. I wouldn't necessarily say that I've made changes necessarily. Like I haven't personally actually created or done anything new. Everything that we do has been around for a very long time. But I think just I really tried to model it and to advocate for families and children. Um, like one of the biggest things is the individualized care plans and the family inclusion. That's not something I created or anything. It's something that we just have implemented that really does work, and we do notice that difference with our families and our clients, with their outcomes, even with our staff, by having them stay with the same client and not, going to different houses and actually understanding the client that they're working with, they even have better outcomes with the care that they're being able to provide. So I wouldn't say that I necessarily am innovating or doing anything different, but the individualized care plans are very big, and it's important to include the families as well in decision making. Another big thing is accessibility in the community as well. A lot of communities put on different events and don't necessarily think about medically complex kids. So, for example, we uh, we just had last year the very first Treat Accessibly in the community in our area. That's not a new program. That is going around all over Canada in different areas. But we were able to bring it to our local community, and it's accessible trick or treating for kids. So people set up stations at the end of their driveway, and kids with mobility issues or who are in wheelchairs or sensory issues
Yeah.
who might not be able to trick or treat on Halloween or at night, they're able to come out and trick or treat accessibly. And so we brought that to the community for the first time last year. And this year we're doing it again. And it's a huge turnout
That's
that
that's
we're planning on having.
that's fantastic.
So again, it isn't something that I created. I just advocated and set it up in our community. And it's just bringing more awareness. So everything that I do, everything that I work on, it's all for the kids and the families. And it's just bringing more inclusion and awareness to them.
Now, that's coming up soon, actually, just a little over a month away.
Yeah.
Looking forward to it.
We're really excited.
Awesome. So not too sure. I'm actually curious myself, right? Do you use any like advanced technology that enhances the home care experience? Or I know it's kind of an
So
open-ended question, but
yeah, so we use a software called WeeCare, and their conference is coming up too, actually. So I'm looking forward to that. But that is our electronic medical record software. So within WeeCare, they have a lot of, AI and functionality to help on the back end of things, like with scheduling and things like that, messaging portal for the family to use. So within that software, families are able to utilize technology, to see notes and to see things like that. But on the actual care side of things, no, we just
it's good. That's why I
yeah,
wasn't
it's
sure. I was like, there might be
yeah, it's
something in
it's
there,
hard in
but
home care.
yeah,
Because well, in home care, all of the children, they should be stable, so there isn't a lot of like you wouldn't have AI technology like
yeah.
in the
It's like the
home.
EMR, like you said, is the extent of it, if anything. Yeah.
Yeah, like our software, but in terms of
So
like
it's
actual
personal care. It's personal care. So
exactly, yeah, you're not bringing AI hospital equipment into the home or anything. So our software is the extent of it.
all right. I'm excited for this one too, even though you just told me about the trick-or-treating event. But what's been your most memorable moment since founding WeCare?
You know what? As much as Treat Accessibly was big, the very first year that we started WeCare, Santa went and did home visits to each of our clients and brought them gifts as well as their siblings. They also got gifts as well. And to see the look on the families' faces and the children, some of these kids have never gotten a photo with Santa before because if you're medically complex, if you're in a wheelchair, it can be a lot to get you out to the mall to get a photo with Santa. So some of these kids, it was their first time, you know, being able to get a photo with Santa. Grandparents were there when Santa could come because they had never seen their grandchild with Santa before. We actually have one client who's visually impaired, and she didn't know that Santa was there. And all of a sudden, Santa touched her hand with his gloves and she started freaking out. She was so happy. It was the most incredible thing ever for her to just experience that because she knew that Santa was there. She heard the bells. She couldn't see him, but as soon as Santa touched her hand, she just lit up. So that would be the most memorable for me.
Give me the chills. Give me the chills right now.
It's yeah, and I think those are just things that a lot of people take for granted. You just think, oh, let's go and get a photo with Santa. And then you start talking to some of these families and, their kid's 12 years old or something. And they're like, yeah, nope, this is their first photo with Santa. And so just knowing that even something so small like that can make such a big difference, not only to the child, but to the family as well. And we always say, we want mom and dad to just be mom and dad. And times like that are when they do feel like they can be mom and dad.
I'm glad I asked you that question. I really did. That one's gonna stick with me for a long time.
Yeah. And actually, to go along with that, last year we did the Santa Claus parade, and we actually had clients participating in the Santa Claus parade, and we made an accessible viewing area so that the kids who are in wheelchairs or things like that could have an area that they could see the parade. And one of the girls who was in her PSW came with her, and she was in a wheelchair, but she was being pushed, and it was her first time in a parade, and her whole family came to watch. And just for the families to be able to see, their child, or, in participating in something that they probably never thought would be
Magical.
possible. Exactly.
Magical.
And that's where the whole inclusion comes in. It doesn't take much to include kids with disabilities. So, we really like to make these events special for them.
Sounds like you do some amazing work. Very admirable. Very, very awesome. Love it all. Big supporter. All right, so maybe we'll switch a little bit to the future. What's next in your eyes for WeeCare, and how do you see pediatric home healthcare evolving? Within the next, it could be months, years, however you see it in your eyes.
Yeah, I think that pediatric home and community care is something that has been not prioritized enough. And I think we will start to see more funding. I think we'll start to see more access available. I really do think that it's going to be improving, which will only bring better care for the children. But I mean, right now in Ontario, pediatrics are only getting 5 to 7% of the funding, and the rest is going to adults and seniors. So it's very difficult for families to get the care that they need for their child when there's only a limited amount of funding. So I think, and that's something I'm working on as well, is, trying to advocate for more of that. Because again, if there's more funding for these families, then they can start living more normal lives, and their child is able to get, more care, and that in turn helps the family, even just be able to go to work, or to just be able to rest and take a break. So I do really see the funding and the awareness being big in the next couple years.
Hope it changes for your favor. I really do. All right. So for possible, families maybe considering home health care, what advice would you directly speak to them?
So, I mean, if you're needing home care, this question's a little bit difficult because it really kind of depends on where you're located. So do you want me to speak just general, or
You're the guest. This is your
obviously we'll cut this part
audience.
out, but
However you see fit. You could go however you prefer.
okay. Sorry, could you repeat the question?
Yeah. So for families considering home health care, what advice would you give them?
Yeah, I would say if you're considering home health care, you have already gotten to that point of caregiver burnout. So the fact that you're already thinking about it means it should probably be in place. So I would contact local funding organizations. I would also look up pediatric specific care in the community that's available in your area, and just also do your research as well. And that's another thing we do is we help our families navigate the system. It's a very complex system, the healthcare system. So sometimes it can take a little bit to get funding put in place, or to get approved. So we always help them with that process as well. Now, if you have private insurance, that's one thing that we always encourage people to use while they're waiting for funding. And a lot of parents actually don't even know that their insurance can cover home care. So we always say to look at that first and see what resources are available around you.
Okay. All right. Listen, I like to keep these kind of just very short, sweet, to the point. I'm going to give you the floor if there's anything else that you would like to share to the followers, to the listeners, to the community. I appreciate your time. I appreciate your insight, the journey. What you do is just fantastic for the community. Also, well, one thing I will ask you to touch on, just let the listeners know where they can find out more about WeeCare, how they can connect, and the floor is yours, Megan.
Yeah, so they can connect with us at our website, which is wecarehealth.ca, and that's we with double E. And then we also have Instagram, Facebook, and LinkedIn as well. I'm also active on those platforms as well. And I think the biggest thing that everybody should take away is just these kids are so special. Like they really, truly are. And we need to do more for them as a society. Whether you're in healthcare or not, there's so many things you can do. And as a community and as a society, we all need to come together to help these kids.
Listen, it's a beautiful message. Thank you so much for joining us. It was a pleasure.
Thank you for
Again,
having
check
me.
it out. We care. Get out there. Facebook, Instagram. You heard it. You heard it here. All right. So thank you so much for your time, Megan. I hope you have a great day.
Thank you.